Hi, everyone. Thank you for being here. I want to begin with a statistic that should not exist in 2026. Black women in the United States are 3 to 4 times more likely to die from pregnancy related complications than white women. That means that for every mother we lose, there are three more who might still be alive if they had to been listened to, respected, or cared for differently. This is not a small gap. It is one of the largest racial health disparities in the entire U.S. healthcare system. And what public health researchers agree on, and what I want to make unmistakably clear today, is that this gap is not caused by biology. It is not explained by personal choices, and it does not disappear when Black women have more money, more education, or more access. This is a systemic issue. It was created by our institutions, our history, and our policies, and because of that, it can be changed. So, Reducing Health Disparities in African American Maternal Care, presented by Aiyanna Brooks, yours truly. Understanding the shape of the problem. Across the country, Black women consistently face worse outcomes during pregnancy and childbirth, higher rates of preeclampsia, hemorrhage, embolism, hypertension disorders, infections, and severe maternal morbidity. What's alarming is that these outcomes persist even when you compare Black and white women with the same insurance, the same education level, and the same access to hospitals. In fact, one of the strongest findings across the research is that controlling for income and education does not eliminate the disparity. Black women with a college degree are more likely to die in childbirth than white women who never finished high school. That tells us two things. First, this is not a matter of individual behavior. Second, this is deeply rooted in structural inequalities. Public health scholars have shown that a mix of medical bias, hospital quality differences, environmental stress, and political determinants of health all contribute to these outcomes. So when we ask why this is happening, we have to zoom out. We have to look at the symptoms around pregnancy, not just pregnancy itself. The root causes. Why the disparity exists. Root cause number one: bias and racism in healthcare. Numerous studies have shown that Black women are more likely to have their symptoms dismissed or minimized. Their pain is taken less seriously, their concerns are questioned, and when a pregnant woman's warning signs are ignored, complications escalate fast. Howell emphasizes that even in top-tier hospitals, providers are often underestimate the severity of physical symptoms reported by Black women. This bias is not always intentional, but it is impact. Root cause number two: social determinants and structural determinants of health. Maternal health doesn't begin at the first prenatal appointment. It begins with the conditions that shape a woman's entire life: housing, transportations, neighborhood safety, job security, environmental stress, a lot of stuff like access to healthy foods, access to quality hospitals. These factors called social determinants of health deeply influence pregnancy outcomes. Studies like RAISE revealed that mothers who struggle with basic needs such as food, housing, or transportation are significantly more likely to face complications during pregnancy. And because systemic racism has historically shaped where Black families can live and what resources they can access, they are disproportionately exposed to these challenges. This is accidental. It's the legacy of policies like rendering disinvestment and unequal insurance coverage. Root cause number three: chronic and toxic stress. The stress of dealing with racism, both daily experiences and structural inequities, has measurable biological effects. Chronic exposure to discrimination, increases inflammation, raises blood pressure, disrupts sleep, and accelerates cardiovascular disease. And all of these factors significantly increase maternal health risk. The Center for American Progress reports that long-term stress can contribute to preeclampsia, preterm labor, and complications that put both mother and baby in danger. This kind of stress is not the temporary stress of a busy day. It is chronic, cumulative, and psychological. For Black women, this means walking into pregnancy with a heavier load on the belly before prenatal care even begins. The root cause why disparities exist. Root cause number 4: hospital quality differences. One of the most overlooked of maternal mortality is hospital quality. Research showed that Black women are more likely to deliver in hospitals with fewer resources, fewer specialists, outdated equipment, and higher rates of complications. Even when insurance and neighborhood are the same, hospital quality still varies. And the hospitals most frequently serving Black communities often face underfunding, shortages, and overcrowding. It is not just who someone is, it's where they are able to receive care. Here go some solutions. Solution number 1: group prenatal care. Programs like Centering Pregnancy combine medical checkups with education, consistency, and peer support. Studies show dramatic improvements for Black mothers, including fewer preterm births, lower rates of low birth weight, and reduced NICU admissions. Why does this work? Because it creates trust, because it gives mothers the chance to learn, ask questions, and build community, and because it provides the time and space that traditional appointments often lack. This model is one of the strongest examples of an intervention that improves both health outcomes and patient experience. Solution number 2: community health workers and doulas. Community health workers and doulas, especially Black doulas, play a transformative role. They help mothers navigate the healthcare system, advocate for them in hospitals, and support them emotionally through pregnancy and birth. Research from Cantor shows that community-based interventions shaped by Black women led to better communication, stronger trust, and improved outcomes. These professionals bridge the gap between the medical system and the community it serves. Doulas reduce C-sections, increase breastfeeding rates, and reduce complications, improve satisfaction with care, and for Black women, they also help buffer against racial bias. Solution number 3: screening for social needs in healthcare systems. When clinicians screen for social needs like housing, transportation, utilities, and food security and connect patients to resources. Both maternal and neonatal outcomes improve significantly. This is critical because social determinants are not separate from health, they are health. When a mother can safely get to her appointments, access nutritious foods, or avoid eviction, her pregnancy outcomes improve. Healthcare systems that integrate social support are not just treating the patients, they're supporting the whole environment around them. Solution number 4: hospital quality improvements and standardized protocols. One of the strongest findings in the literature is that standardized care saves lives. When hospitals follow strict protocols from hemorrhage, hypertension, and infection, maternal deaths drop, especially for Black women. This means better training, bias reduction programs, emergency preparedness, timely escalation for care, and continuous monitoring of outcomes by race and ethnicity. When hospitals take responsibility for identifying disparities in their own data, they can change their systems in ways that saves lives. conclusions. What we can do as a collective and group together. Here is the message that I would like to leave with you. Maternal health disparities are not inevitable. They were created by systems, and that means they can be changed by systems. We have the research, we have the evidence, we know what works. Group prenatal care works, doulas work, community based interventions work, addressing social determinants of health works, hospital quality improvement works, policy reform works. Now we need income or zip code deserves the same chance to survive childbirth and to raise her child in health and safety. And improving maternal health for Black women improves maternal health for everyone. It is time to listen, to act, and to build a system where every pregnancy is safe and every birth is a moment of joy, not a moment of fear. Thank you. And here are some my references and credits. Thank you so much. Have a good nice rest of your day. Sorry, I sometimes stutter, but yeah. Bye. Hope this helped.